This is where the difference between Hahnemann and Kent really come to the fore. So Hahnemann really had a list of symptoms. And so they were really just looking in a very open kind of fashion. And what are the most characteristic symptoms of this case without trying to form a whole personality picture? That really, in my opinion, wasn't part of the Hahnemannian endeavor. You don't ever go by abstract categories, and that includes, of course, nosology, the classification of disease names. We never prescribe on disease names, obviously, and so on. So that's very Hahnemannian, So you go by phenomenology, and this means how does the person experience the world subjectively, and that's why it's so important to listen closely. It's very close, simple observation, but that is, for us humans, it seems a very difficult thing, because we want certainty, and we think we find certainty in mental abstractions. So the big break then in homeopathy came with Kent's lectures on materia medica, and I love them. However, he did something very...
Hello, homies, and welcome back to Homeopathy Hangout, where today I have an incredible treat for you. We have the lovely Ralf Jeutter on the podcast with us. Welcome to the show, Ralf.
Thank you. Thank you, Eugenie. Wonderful to be here. Thank you.
Now, I absolutely became your biggest fangirl after I recently started CHE Australia. And part of that was that, I had to, because I didn't graduate from CHE myself. I graduated from a different college many years ago. And so I got to be a student all over again and watch all the lectures from all the different lecturers, because CHE is really great for that. They've got such a wide variety. And then there's this guy called Ralf Jeutter that came on and just blew my mind. And I messaged Marcus and I was like, I need to get this guy on the podcast because you are an incredible lecturer. You're also really funny. You throw some great little jokes in there, and sometimes they're so, I don't know how you call them. Is it like a dry humor? But you can see the students are not even laughing because they not even realize that you're making a joke. And I'm meanwhile like laughing my head off on the other side going, that was so funny. And you have got a PhD in philosophy, and you've done acupuncture and podiatry and so many different things. So I'm really excited to have you on today because I have loads of questions for you. But we have a bit of a tradition here on the podcast, and we get all of our guests, no matter how famous they are, to tell us of how they were first introduced to homeopathy. So I'd love to hear your story.
Okay, no problem, Eugenie. Thank you very much, first of all, for this introduction. I always feel like I could be like a podium, because I always feel really uncomfortable with this kind of compliments, this description of the lycopodium when they're being thanked and they feel really awful about it. So I always have this kind of sense. But anyway, thank you very much. And just to put things into perspective so that the listeners also know what's going on. So I'm doing podiatric medicine, which is all about the lower limbs. And so, it's basically, how can I say, a very practical way of dealing with people's problems. And I guess we could say sometimes it's sort of the mechanical kind of problems we encounter where you have to remove certain things. We do little surgeries like nail surgery and stuff like that. Or we do MSK assessments, where we just have to use certain interventions, So I would call this, we can cover quite a good range of non-dynamic diseases, if you see what I mean, So this is part of what I do. The acupuncture, just to be really clear on this, that was just a little add-on to my podiatric practice. So I'm not an acupuncturist, okay? But I'm using other interventions, and that could be interesting in the context of homeopathy, of course. For example, I really like fascial manipulation or bilateral nasal specifics, it's called. This is a certain osteopathic technique, very powerful techniques to use. And of course, my teacher, Andres Hani, always says, if you only do homeopathy, you don't do homeopathy. You actually use other interventions as well, judiciously. And of course, we all know this from the Organon 285 to 291. I mean, that's where Hahnemann outlines all these other really important interventions we need with homeopathy. And the first one is, of course, always lifestyle, But anyway, to get to your question, it was all very long time ago, over 30 years ago. And it was actually my then wife, my first wife. There are only two, by the way, not that you get the idea. I have many wives. But anyway, there was my first marriage.
Thanks for clarifying
that. Yes, very good. And so anyway, my first marriage, and she was an archaeological restorer, and she worked at quite a well-known museum, and she had all these strange allergies from the substances she worked with, And I was not into medicine at all. I was all into literature, philosophy, and this kind of thing, and very sort of academically driven, in a quite conventional way, if you like. And then she went to this person who did bioresonance with her. And she had, strangely enough, an allergy to formaldehyde, I think it was, and then also to wine, of all the substances. But anyway, so it was this thing with the bioresonance where they put the. They feed it back to you, and somehow something should happen there. And I was just sitting there, typically academically skeptical, of course, thinking, yeah. And then it just was amazing. It just had this amazing result. So I got curious, and then, of course, that was isopathy, so I didn't really know at this stage about homeopathy. But I got hold of this little book by an Indian homeopath, and I still love it, of course, because it was my first introduction, called Iyer, Iyer, Dr. Iyer. And I think that's how you say it. So anyway, I read the foreword, and I remember reading the foreword, and it was for me like, oh my God, if this is true, I really have to rethink everything. I know how this world works, because there were all these principles, be it the similia principle, which was less challenging, then of course the high dynamization. I mean, what? You're using remedies where actually there's nothing in there. And the usual thing, I think nearly everybody goes through once you encounter homeopathy. But I found it exciting rather than, well, challenging and exciting, but more exciting than challenging. And so it started from there, that I thought, I need to look into this, and then it was all academic. I just read and I found it interesting, but at the same time I was a lecturer at the university, so I had to continue, of course, with all that. But the pressure became more and more that I really wanted to do something which is practical, and which actually helps people, and not sort of publishing things nobody reads anyway, which is only part of the small academic circles, and so on and so on. So that's how it started. And then I did the 10 weeks course with a wonderful homeopath in Manchester, still one of the, Helen Wally was her name, or is her name, and just one of those wonderful homeopaths. And from there, I then realized, oh my God, where I lived in Manchester at the time, we have a wonderful college, the Northwest College of Homeopathy, with a wonderful principal, Ernest Roberts. So this was all this generation, like Tony Hurley and Ernest Roberts, and they were just wonderful people, Janet Snowden, David Mundy, wonderful teachers who I really, really appreciated and loved, And so then I did this course while I was still at the university. And then over time, it was clear to me, I have to really now make a decision here, And that's really how it started. And then I very quickly got into teaching the homeopathy and so on and so on. That was basically continuation of my former skill anyway. And so that's really how it started. And then,
And how crazy that Tony Hurley is still teaching. He's one of the lecturers at CHE as well, obviously. And
Yes.
yeah, he's lovely.
Well, Tony, for me, is a great example of, if you look after yourself and have your, let's say, values right, you go a long way,
Well, actually, speaking of Northwest College, I was just on the phone with Ambika Waters this morning because we've had a few Zooms recently. And, she's just recently had her 80th birthday. And I don't know if you've seen her, but she looks fabulous. Actually, this necklace she sent me,
Oh, wonderful.
she looks fabulous. She's just in such great health. And she is just an example of, if you look after yourself and you're using homeopathy. I mean, she uses homeopathy in her skincare and, everything that she
Mm,
does. And she just looks amazing. And Tony as
mm.
well. Holy moly. And I was just going to say, at the university, so were you teaching philosophy at the university?
Well, I was actually in the languages department
Oh,
in the
languages.
Metropolitan University in Manchester. And so it was really a German course, BA, MA level, up to PhD in exceptional cases, but basically BA, MA. And basically, we did German literature. And of course, part of that is always German philosophy, also German language. That's really where I come from.
Wow. Well, speaking of the German language, you've just given me a nice little segue because
Yes.
that is the thing. Obviously, you teach concepts of health and disease at Center for Homeopathic Education. And I am sometimes jealous and sometimes not of people who can speak German because you get access to so many incredible textbooks. And I just figure I can't even read the ones in English as it is because there's so many, I don't get through them. So if I could read German as well, I would have more books that I don't have time to read. But you have the incredible advantage of being able to read the Organon in its purest sense without it being interpreted and actually understanding the true meaning. Because obviously, English is my second language as well. Afrikaans is my first language, although maybe it's swapped now. But there's some words in Afrikaans that no matter how hard you try, you cannot translate it into English. And I know it's the same for German. And so there would be some things that Hahnemann would have wanted to convey through his Organon, which there's just no way you can really get the true essence of that in English. So something I would
Mm.
love to hear from you, because this is something that you teach and so passionate about, is what are some common misconceptions about the interpretation of the organon that you see people doing?
So let's start with this. I mean, one of the things I did right from the beginning when, I studied homeopathy at the Northwest College of Homeopathy, which was a great experience, which was wonderful teaching, wonderful, as I said before. But what I did in parallel all the time was reading the Organon in the original. And I mean, for me, it was easy to read it because, coming from literature and also from, let's say, some complex literature, also 18th century literature and so on. So it was fairly easy for me to read the Organon. And I found it actually fascinating. I think that Hahnemann is a great stylist, a wonderful writer. But of course, he uses these endlessly complex, long sentences. But this is the German thing, and especially the German thing in the 18th and 19th century, And so what happened over time, and I will answer your question, Eugenie, but I just want to give it a little bit of context, And over time, what I realized was there was a certain mismatch between the teaching I got from the college, which I always appreciated, which I loved, but it didn't quite tally with what I read in the Organon, And it took me a good 4 years, basically the whole course of my education with the Northwest College of Homeopathy, to figure out that I was being taught Kentian homeopathy and that I was reading Hahnemannian homeopathy. And so I really had to make sense of that conflict. And there is a certain conflict, of course, on another level, they meet again, but there is a certain conflict with this, and we can go into that because I think it's really essential and important to understand that. And so that's how I, by the way, also got to my teacher, Dr. André San, who went through the same process, but way before me when he was in America. And he was at a college in Ontario, and he had access to all these wonderful journals, and of course, anyway, to Hahnemann's writings and all of this. So to the old homeopath, to the 19th century homeopath, to Lippi, to Guernsey, to Farrington, to, of course, also Kent. But he also noticed that there is a mismatch between Kentian teaching and then Hahnemannian teaching, And this is what I had to resolve first. And that's, of course, why André Sen was so important for me, because he went through the same thing and then he resolved that conflict. And once you're clear on the differences, everything becomes much easier, And we can go into this, into the differences, if you like, a bit later or maybe now.
Yes, please. Like, this is what I'm here for, because I just feel like you are the voice that can really help us get clear on all of this. And we haven't had a podcast about something like this before. So if you feel
Okay, so
called to say or share anything, just go
yes.
for it. I'm just going to stay quiet.
We'll do that. So the first thing is let's just put it like this. I wouldn't say if you don't read the German originals that you're really at a disadvantage. I mean, imagine if that would be the case. That would mean really that only German speaking and German understanding people can be good homeopath, which is obviously complete nonsense, And then, of course, I can read the primary sources, but it is not, that doesn't need interpretation. And there isn't certain confusion about that, or let's say a way of just interpreting what I'm reading. And sometimes what I do in order to understand the German better is I go to the English translation and see what did they make of it? What did they make of this sentence? And sometimes that helps me to say, okay, they see that this is what Hahnemann meant, and so on and so on. And then, of course, we have two wonderful editions of the Organon. I mean, we have the Böricke edition, which is fine, but we have two wonderful editions. That's the O'Reilly edition, as you know, and then we have the Künstli edition. And the O'Reilly edition is the very scholarly work. It has a wonderful glossary, it has great annotations, and it made an attempt, which I think, and I want to really be careful here because I have a lot of respect for this work, but I think that there is a certain failure in this, and this is that they try to emulate the language of Hahnemann in English. And I think often it is too clumsy. It's, too difficult to understand because the English sentences are short and succinct, and the German sentences are long and many parentheses and so on and so on, And so in that way, I think the O'Reilly edition gives you a really good, thorough understanding of the concepts, and also they make a real strong attempt to translate it as closely as possible to the original, but sometimes so close that they even use still a German word, And so, of course, how useful is that for other people like Wesen? They use this because they didn't find a better translation, I guess, I hope I don't misrepresent this now. And then, of course, we have the wonderful Künstli edition. And this is the readable edition, and I would really recommend that to students to get basically familiar with the Organon, but just enjoying reading the Organon, because the O'Reilly edition is quite hard going. but the Künstliche edition is very, very good. And I would say one thing, I mean, there would be little things we would have to look for, but I would say one thing where there is a misrepresentation, and this is unfortunately also in the Künstliche edition, is in the sections on the mental emotional symptoms, 210 to 230. And there is one section where they speak about the mental constitution, that we address the mental constitution. And of course, as soon as we say that, constitution really means the healthy state of a human being, and what Hahnemann really says is the altered mental state of the person. So these are very different things, and he stresses the altered, so the changed mental, and it's a state, it's not the constitution. So meaning something we go through for a while, but then, of course, when we get back to health, we really go back to our constitution, whatever that is, which is then non-pathological. So we still may be a little impatient, we still may be a little angry, we still may be a little hurried, all of these things, but some people are like that, and that's normal. So in a sense, you don't change their constitutional personality makeup. We don't do that. And so I would say this is maybe a good or very glaring example of a mistranslation and of a misconception where then people really will have problems making a distinction between the healthy state of a human being, which does not to be addressed, which does not need to be addressed, and the pathological state, which sort of obscures the constitutional or healthy state of the person, So I would say that's one of the examples,
That's great.
And
Can you
otherwise,
say a bit more about that? Because that's something that I think is actually really important. Is there anything else that you can say about that?
yes. So, I mean, what are we supposed to do in a homeopathic consultation? Keep in mind what the definition of disease is. Hahnemann says is a change in function and sensation, a change in function and sensation. So that means at some point there is a baseline, a baseline of health. So how have you been? How have you normally been? And then something happened. And then, health got deviated, now you're on the wrong track, if you see what I mean, so now suddenly there has been a kind of corruption to your system, and now there is a changed state. And so, for example, let's say you have been a very placid, easygoing kind of person, but by acquiring the disease, if you like, or the illness or the sickness, you now become very impatient, you become very angry, and so on and so on. So it's that changed state we are looking at for the prescription of a remedy. So this is the key, really. And then we have, of course, the baseline. If they go back to where they've been before and they're very comfortable again with, what they do and so on and so on. Equally, of course, and Hahnemann gives this example. He gives the example of somebody who is actually quite a nuisance, and quite unpleasant, in his life. But that is the normal state. Now they fall ill and they become actually quite patient, quite nice. And that happens. You see this where you think, well, they're much nicer when they're ill, But of course, the thing is still to get them out of that state and bring them back to where they were before. And if they were unpleasant people, well, they're healthy, unpleasant people, But not everybody wants to be pleasant or needs to be pleasant. Do you know what I mean? So it's this kind of thing. So we're looking at the altered state, at the changed state, So that's one thing. However, it's maybe not quite that easy because, of course, what we also do in a complete homeopathic consultation, and a complete homeopathic consultation takes a long time, and you can read it up in the Organon, all these things we have to ask. And I think that's one of the things we don't do, or many, many homeopaths don't do enough to really take a very, very, very comprehensive case, which can take hours, of course, if you are dealing with very complex pathologies, And then, of course, as you know, we need the whole timeline. So, of course, we want to see the whole picture of that person mapped on the biological level, psychological level, disease level, and then, of course, on the spiritual level, if this is part of it, and so on and so on. And then, of course, what we take into account is how has this whole human being evolved over time? And then we are looking, of course, for the common threads, the red threads, which have gone through all their life, and that's, of course, then something you could call constitutional prescribing. And then you have the biggest possible totality. And this is, of course, what we ideally prescribe on, but this is not always to be had. We have to be clear on that. You cannot always have that big picture. Even if you take a 4-hour case, you may not get a coherent enough picture in order to prescribe just one remedy. You may have, and these chapters, it took me a long time to understand them in the Organon, but you may have dissimilar diseases, where you have basically diseases which cannot be dealt with one remedy. So you have to make a choice. What do we do now? Where do we start? And of course, a classical or a Hahnemannian homeopath would still start, of course, with one remedy, but would address a particular segment of the totality in order, first of all, to alleviate that, to get improvement there. And then we could have a look at the other segment. Maybe an example, and I'm making this up now, but would be a person who suffers from extreme migraines, but at the same time has rheumatoid arthritis, let's say, but it is clear that the migraines are the ones which really impact most on that person's life, really make their life a misery. But you do not find a remedy which would cover both entities well, both disease entities well. So then you would have to start with one segment of the totality, that's what I would call it, and then see that you get an improvement there, and then you can move on to the other, So these situations arise, of course, So what I want to say is, on the one hand side, we look at the changed state of the person. So how have they changed with the illness, with the sickness? And then, of course, also we look at the continuity of the patient. So, of course, we also take into account their personality, their overall outlook on life, and if we then do our comparative materia medica, we of course go more with that remedy, which covers also their personality, and I hope that's sort of clear, but this is the kind of thing we have to do. And this is where it's always about our judgment. It's always about our discrimination. And that makes homeopathy difficult,
Yeah, it really does. And you, in one of the lectures, you were saying, it would be good if we can kind of like standardize homeopathy more, so more of us would get to the same prescription. But if you had 100 homeopaths, they'd probably all give 100 remedies. But maybe that is the power of homeopathy, that I don't know, that we can see a case so differently. But you just touched on, the constitution before. And so often, when I did my training, which was also very classical, we were taught, it's the constitutional remedy, and that's like the one that you go for, and, it fits the person on all levels. But the more I've been practicing, the more I just realize it's actually not that easy sometimes to find, because especially when there's lots of traumas and there's drug layers and there's all these things that happen. And so a client, especially if they've been listening to my podcast or they know a bit about homeopathy, after the second appointment, they come back and go, okay, so what's my constitutional remedy? And I'm like, I don't know. Because there's, especially if you've had a client that's been on antidepressants for 20 years, I mean, they don't even know who they are. How am I supposed to know who they are? But if you had to say, like, what is a good answer that we can give to somebody who wants to know, what their constitution is? Like, how do you even find their constitution? What is the constitution?
Yes, let's look at it historically. And again, and this is where the difference between Hahnemann and Kent really come to the fore. So Hahnemann really had a list of symptoms. That's what he prescribed on. The materia medica were a list of symptoms. And there was no attempt, barring a few remedies. He talked about the Ignatia type of personality, pulsatilla type of Nux vomica. But basically, you have a list of symptoms. And so they were really just looking in a very open kind of fashion. And what are the most characteristic symptoms of this case, without trying to form, a whole personality picture. That really, in my opinion, wasn't part of the Hahnemannian endeavor. It was more like, okay, we have a changed state of the person through illness. How do we match that with a well-known picture in our materia medica, which really is a list of pathological symptoms? That's what it is, So with Hahnemann, it was what we call the phenomenological approach. So you just go by facts, you go by observations, you don't ever go by abstract categories. And that includes, of course, nosology, the classification of disease names, we never prescribe on disease names, obviously, and so on. So that's very Hahnemannian, So you go by phenomenology. And this means, how does the person experience the world, subjectively? And that's why it's so important to listen closely. And Hahnemann always stressed the language of nature. So, of course, he wanted ideally his patients to express themselves in very simple terms. So what's wrong with you? tell me, what is your sensation? Tell me what makes it better, what makes it worse? Tell me, is there anything which goes with it? Do you know what I mean? It's very close, simple observation. But that is, for us humans, it seems a very difficult thing, because we want certainty and we think we find certainty in mental abstractions. That's often the case, and then we want to give it a name. And then we give it some kind of abstract name and we think, oh, we settled this thing, So the big break then in homeopathy came with Kent's lectures on materia medica, and I love them. However, he did something very different to Hahnemann, because for the first time, he tried to portray them as personalities. I mean, think of what he says about lycopodium or sepia, the washerwoman, and stuff like that, So he now gives us portraits of remedies. And I think that's where people then more and more thought of, oh, that's a sepia, oh, that's a pulsatilla, and so on and so on. And then you come to this thing, oh, I don't want to be this, I don't want to be that, but a phosphorus, yes, I'm a phosphorus, and so on and so on. And that's, of course, in a sense, and I do mean this not disrespectfully, but that's, of course, nonsense, because nobody wants to be a phosphorus. I mean, a phosphorus state is an awful state of disease, is an awful state of illness, like any other remedy state is just a state of illness, a state of disease, And so I think this drawing, portraying them as personalities is misleading, because there is no healthy sepia, there is no healthy phosphorus. We can maybe, of course, deduct from what we now see as a pathological picture and then see how they are in their healthy state. But it's still not right to call this a healthy sepia, healthy phosphorus, and so on and so on, And then, of course, that was taken much further by Catherine Coulter. Again, all respect to Catherine Coulter, and I think she's done a wonderful job with her portraits of the remedies. I don't know exactly what it's called, something like that. And I read it with really great pleasure, and really great interest. However, what I also realized was that now I was stuck with a certain image of the remedies and caricature, like lycopodium has to be a coward and stuff like that, And so I couldn't get that out of my mind. And then, of course, that was taken even further by drawing up these essences, like Vitulcas and his essences, and Vitulcas actually regretted that book, because he realized that he gives too many shortcuts, to people. And then people just go with the essences rather than going back to what Hahnemann did. And this is, of course, looking simply at the symptomatology of the case. And not just the symptomatology of the case. We're talking, of course, the totality of the symptoms. We should really say the characteristic totality of the symptoms, But ultimately, they are just facts and phenomena with Hahnemann, and later on they became, and Shankaran took it even further with the soul of remedies, and so on and so on. And then they became more and more personal interpretations of these remedies. And what we then lost is the complexity, And then, of course, we were more and more, let's say, focused on the mental picture. And with Hahnemann, remember, in the Materia Medica Pura, his mental pictures were right at the end of the remedies. Only in chronic diseases did he change the pattern. So for him, the mental picture was just one among others. Very important. He stresses that again and again. It's very important, the mental picture, but it's not to the exclusion of everything, And so I think what happened over time was that homeopathy was more and more going into the direction of mentalized homeopathy, and people then didn't know anymore what are actually the eye symptoms of pulsatilla. What are the, let's say, the joint pathologies, the extremities pathology of pulsatilla, and so on and so on. So we lost a lot of information or a lot of focus on really, really important characteristic symptoms, which are in these remedies, And so only then do we realize how rich and how complex our remedies are. And this is why even after 25 years, we discover new things about Ignatia or about lycopodium or whatever the remedy is, because these things are not really fixed, and they're not, you cannot just shortcut them or give them just some punchy headline and say, this is the remedy, and so on. So I think is this. And then with that also came, we are now at this topic of psychologizing. I think we put in too strong an emphasis on the psychological picture, or on the psychological well-being of the person, let's say, or to the exclusion of other things. That's what I mean. I mean, of course, it's important. The psychological well-being is important, but that we tend to theorize far too much about the psychological state of the patient. And I think that also came, of course, with the advent of psychoanalysis, and then the great Freud revolution and Jung revolution, and so on and so on. And all of this, I think we took, and homeopathy was then became part of that wave, really, of looking more and more to the exclusion of everything at psychological things. And I think that's where we can learn a lot again from Hahnemann, by actually going back to studying these remedies in their pure form. And that includes the provings. And hardly anybody does that anymore. And I think it's very, very useful to do this, And what I always say to students, even if you don't do anything else, but at least, because that's usually where the most interest is, at least read the mental pictures of the remedies according to Hahnemann. Read like a podium. And we are talking 1.5 pages, never more than that. If we look at modern provings, and that includes mine, I did a proving with selenite, you have 45 pages of mental symptoms. And after a while, of course, you have to ask, how useful is this? Because after a few pages, you lose the focus. You don't actually know what are the key features here. And that way, I think we have overburdened our materia medica with psychological so-called symptoms, and we have lost even focus of what a real symptom is. It's something quite simple. It's something which deviates from our normal state, So anyway, in that way, I think it's important to simplify homeopathy again and to get away from too much theorizing, especially psychologically. But anyway, so...
Do you know, I am just so grateful that you're on, because like I said to you before we start recording, I feel like you're such a sober voice in the homeopathic world, like getting us back to basics. Because let's face it, there's so many shiny stuff in homeopathy. It's really easy to lose your way. And let's face it also, the psychological stuff is fun. It's really interesting. Yes. And part of me wonders, Hahnemann was an Aries. I'm an Aries as well. So I'm the 4th of April. He was the 10th. And so sometimes I feel like we're like kindred spirit, because I'll read the Organon and he'll go on a rant and I'm like, oh man, he sounds so much like me. It's so funny. But I frequently change my mind about something. I think I know something. And then I just completely changed. I'm quite happy in the Aries way to just move on. I don't hold on to things. I just kind of move on to the next thing. And sometimes I wonder if Hahnemann would have gone this direction, like I wonder if he would have ended up like psychologizing remedies in the way that we are. Or do you think we've kind of got a little bit too far? Because this is the thing with homeopathy that I'm constantly asking, are we going too far, or is this like a natural progression? Because I feel like homeopathy today, it's not something you can grasp, because everyone's doing everything for it. It's like the Wild West of homeopathy. Anything goes. And we've got, what, 8,000? I heard somebody say the other day, 9,000 remedies. Who knows? I've just made a new remedy on my desk. So now we have 9,001.
Very good.
So, yeah, where do you think there's a place for all the craziness out there? Or do you think it's worth just kind of like sticking with the basics and,
Okay, so I think that there are two aspects. I mean, one aspect is that, first of all, with what Hahnemann would have done, who knows? That's a simple thing. We don't know how he would have evolved, I think it's fair to say, so we have to look at I think we can look at the answer when we look at the continuity of his work. So what has changed, what has not changed in his work? And one thing is very clear. I mean, we are talking about 50 years of homeopathy. If we say the experimental phase where he was sort of finding his way into homeopathy, maybe 60 years, but not more than that. So 50 years, we have certain unchanged things with him, and the unchanged things is obviously this Milia principle. It is the one remedy prescription. There are very few exceptions where he alternates the remedies, for example. And then, of course, we have using high potencies, what he called high potencies, which, of course, then became much, much higher later on. But for many, those were already too high. And he went highest 200. Somebody said he possibly used also the 300C, but let's say the highest he used was 200C, and then he used the LMs, of course, But these were highly dynamized remedies. So these are the three principles, and they never changed. And therefore, I think we can sort of speculate and say they wouldn't have changed further down the line, And then I would also say probably his approach to finding the similia, by having very good materia medica, solidly proved, like according to the Hahnemannian provings, plus the disease picture, and we match these two similia principle, I don't think that would have changed. And he would have insisted, of course, on the accuracy of the provings, on the trustworthiness of the provers. He would have done it in higher potencies and so on, but it would still have been a fully Hahnemannian proving. That would be my opinion. But of course, that's neither here nor there. If somebody says to me, oh, no, he would have loved later on meditative provings, I have nothing, I have no proof that he wouldn't, But anyway, that from his development, I would have said that would probably have remained the same. And what would have changed, there's no doubt about this, and this changed all his life, was the posology. because that was his main focus of how do we find the optimal dose. Some call it the minimum dose, but really we should call it the optimal dose, optimal in the sense of doing no harm, but being effective, and Hahnemann, right to the end, right to the last day, experimented with that. And I think again, that's fair to speculate on that he would have loved the high potencies. He was a little wary of them. He was a little like, my God, we are going into a ridiculous territory here. It's difficult enough, to convince people of homeopathy. But if we even go now to a 10M and so on, which he, of course, didn't know, but maybe he would have had reservations because he wanted to standardize homeopathy in such a way that everybody, first of all, uses the 30C. Because he thought, okay, that's a good potency. It's highly dynamized. There's nothing in there in terms of chemical, substances and so on and so on. So let's use this for a long period of time, and then we can compare our results. That's what a scientist does. And he was, of course, very scientifically minded, So I think there would have been a change, Then the other thing which is very interesting is that, you see, the miasm theory of Hahnemann is, of course, the precursor of the germ theory. Yeah. And I think he would have, and that would have been really interesting, he would have probably sort of celebrated the fact that the germ theory came into being, and he would have said, told you so, I always said it, but I didn't have the vocabulary. I didn't have all the technical facilities. But now you see, through infection and through suppression of infection, through microorganisms, infection through microorganisms, then suppression, you get secondary symptoms, you get chronic disease. That's my miasm theory. And his miasm theory is an infectious disease theory, full stop. However, the really fascinating thing would have been the encounter with Kent, because Kent, at the height of the germ theory, and for a long time, I thought, Kent, you're ridiculous. That's what I thought. My God, here we have the germ theory, and now we have the proof that microorganisms cause disease, and that the suppression of the infections then cause secondary symptoms. And what is Kent doing? He said, all nonsense, all nonsense. Has nothing to do. The bacteria are secondary phenomena. They only are opportunists, so to speak, opportunistic infections, but the disease state is there already, and the disease state is a spiritual disease state. That's really what Kent said, and you could say it's psychological, but really it's a spiritual disease state, because it's the fall from grace. We have been exited from Eden, from the paradise of Eden. That's Kent's miasm theory. We have lost our connection with God, and therefore we have the susceptibility to fall ill, okay? Now, looking at it from our end now, because we are at the end of the germ theory, that's what I would claim. And we have to be careful here, but we seem to be at the end of the germ theory. It's a very exciting period now, because again, the cracks become so obvious, and we have now this book, Can You Catch a Cold, by this Australian researcher. I can't quite remember his name. You maybe know it, and he is very clear. It's amazing. He just put together all the evidence we have about the possibility of infecting other people, of infecting one, of one infecting the other. And he looked at all the history of all the trials which have been done. And his conclusion is zero evidence for that you actually can infect other people. And that sounds, of course, to us very challenging, and it's very difficult to compute, simply because we have been so trained, and so you could even say indoctrinated into the germ theory, that this is a step too far. And immediately our mind says, well, what is it then? But I think, hey, let's be careful here. Let's be patient. Let's first of all take one thing down, and then see whether we got a better hypothesis, and there are some out there which we don't have to go into now. But so I think in that way, it would have been interesting how Hahnemann would have dealt with his miasm theory, because if the germ theory goes, certainly Hahnemann's miasm theory goes, so I think, and we have to be clear on that, because it is an infectious disease theory. Now, if this doesn't hold water, then this whole miasm theory goes, which wouldn't be the downfall of homeopathy at all, because you can, in my opinion, practice homeopathy wonderfully without using miasms,
Well, it would be
So
the
that's
first
what,
ever thing in homeopathy in 250 years that turned out to not be true, because, this is the thing I think about homeopathy is we're still using the same principles and the same remedies and the same everything for 250 years.
yes.
Do you know Ariana Zappa? You might, I've got her book
Do I know
here.
who?
Ariana Zappa. Here we
No,
go.
I don't.
Oh, she is a German lady. She wrote this book, My Microbes Army. And
Yes,
it's also that's, it's along those same kind of lines that, viruses aren't real and all that sort of stuff. And there's definitely so much more coming out about that, about it's not being real. And I've been just listening to a couple of podcasts on Germany medicine, but I have to, because I
yes,
think that's the same kind of thing that germs are kind of not real
yes,
and it's all. I've listened to a couple of episodes and I am really struggling to get my head around it. I will get somebody from that does GNM on the podcast at one stage, but it really
yes,
challenges me massively. I
yes.
can't get my head around it, so I should probably listen to a bit more.
Of
But
course,
there
but
is interesting things coming out, that's for sure.
usually, I mean, the German new medicine, I'm a great fan. I don't know it well, but I'm a great fan, of the basic concepts. And I'm a great fan of Rika Hamer, the doctor who came up with this whole German new medicine. It's just the most amazing, in my opinion, the most amazing, well, I wouldn't want to call it theory, the most amazing way of treating people. And Rika Hamer for me was clearly, he was the second Hahnemann, like a second Hahnemann, in a different field, of course. I mean, in the medical field, not homeopathy, but as revolutionary. And we will see the fruits of that more and more. And so we know, of course, there are certain doctors in Germany who question very much, the virus theory, and where they even went to court, to the German courts, and said, okay, what is your justification for enforced vaccinations of measles? Show me the virus, And according to his story, 3 times he did it, and they never could actually produce the virus, which allegedly causes the disease. He still lost the court case for whatever reason, But anyway, so there are all these efforts out there. And of course, German new medicine, and I don't want to get into this here because I'm not at all an expert, and it would be great if you had somebody who talks about this. But of course, we are looking at conflicts, conflict resolution. So this is something which is much more, again, you could say psychological, spiritual, however you want to call it, but it's not mechanistic. It is not the mechanistic infection through microorganisms, material matter, which then somehow gets into your body. That was also Hahnemann's thing, keep in mind. Material matter which gets into your body, now provides the terrain, you could say, to become ill. But with Hahnemann, it was the infection first, and of course, with Béchamp, you remember Pasteur and Béchamp, they had this discussion. With Béchamp, of course, it was no, the terrains first, So if your terrain is already compromised, then the bacterial infection or whatever it may be will have a real effect on you. But if your terrain is not compromised, then you will just throw it off. If you're healthy, then why should you become ill? Why should you even have the breakages in your system, which allows disease to come in, And of course, Kent, with his spiritual causes of diseases and so on and so on, I think this could be, a revolution also within homeopathy, which is still to happen, which would be a complete fundamental shift also in our miasm theory, according to Hahnemann, and so on and so on, But it has to be clarified much more than it is now, because often with Kent, what simply happens is that we look at the mental, emotional symptoms in a quite, I would say, mechanistic way. They must be the most important. We put them at the front, and we somehow have to find all these mental, emotional symptoms. And then they turn out, well, they're not really symptoms, they're just normal events in a person's life. That's how they normally think. That's how they normally feel. Yes, they're a bit jealous, but hey, this is not pathological jealousy. Yes, they're a bit angry, but this is not pathological anger. They're a bit sad, but this is not depression, and so on and so on. You know what I mean? So another shift, I think, is coming also with homeopathy, and it could be in a very interesting way led by Kent rather than Hahnemann, because the germ theory could fall, and I hope it does, because what it does mostly is it brings down the whole edifice of the vaccination industry, because the vaccination industry is based on the infectious disease model. All this COVID madness is, of course, based on the infectious disease model. You can now tell people, oh, there are all these pathogens out there and they're lurking everywhere. Even if you don't see them, even if somebody is not ill, they still may be a time bomb and they will then sort of infect all of you, and so on. This is all madness,
Mm,
And once that goes, I mean, can you imagine how freeing and liberating that is? We do not have to fear these things. What we have to fear is not to live healthily.
mm,
That's all, and not even going into fear there, but just live healthily,
mm,
do your best to live healthily.
mm,
That's really what we need to do,
mm,
Then one thing, the second thing you mentioned there was, I mean, yes, there are crazy things out there with homeopathy, But we have an age-old debate, and so therefore I want to be a bit careful. There's an age-old debate in homeopathy, which was really started by Carol Dunham. And Carol Dunham is one of the best and most wonderful homeopath, but not only that, but also one of the most wonderful people, characters, personalities we had in our ranks. A wonderful person. He also, of course, invented his own potencies and so on, which we still use. We still use the Dunham potencies from 1858, and they're wonderfully powerful and all of this stuff, different way of succussion and so on. But anyway, we don't have to get into this. But Carol Dunham gave a very important speech in 1870 to his colleagues in homeopathy. So we are at the height of homeopathy now, and there were always divisions within homeopathy between the high potency prescribers, that was the topic of the day, and the low potency prescribers, the low potency prescribers like Hughes and so on in England. And then you had the high potency prescribers like the Americans, like Kent, of course, and out of Lippe, Guernsey, all of them, and so you had this conflict. And also, of course, the conflict between eclecticism. So are we allowing conventional medicine in our homeopathic ranks? Are we allowing to use certain interventions, allopathic interventions, or are we then not homeopath anymore? Like today, for example, we say, we use antibiotics instead of homeopathy if we don't know what to do, this kind of thing. And Carol Dunham gave a speech on something like the freedom or the liberty in homeopathy, and he was very much in favor of anything goes, as long as we help people, but please allow, and I'm really sort of abbreviate that, is a much more complex argument, but basically he said, please allow tolerance in our ranks, and let's not be too prescriptive about what is homeopathy, And so some people think, of course, that's a wonderful thing to do. Thank you very much. But others also said, look, this was the downfall of real homeopathy, because we need the gatekeepers. And the Hahnemannian homeopathy is very clearly defined. There is no doubt about this, but you have to read the Organon in order to know how it is defined, And since then, we have actually a problem, a misunderstood tolerance, that we allow this to happen and so on and so on. Now, for me, from my personality, I would be much more on the side of tolerance rather than saying, only this goes. On the other hand, my mind tells me, well, if we really want to get homeopathy back on track, and we really want to give it a clear definition and a clear, let's say, professional standing and a consistency in practice, which is a collective consistency, not governed by individuals' ideas about homeopathy and great inventions, this and that and this, a collective kind of a forward step with homeopathy, that we do this collectively. In my opinion, that's what my mind says. It can only be done on the basis of Hahnemann. And there's only one definition of homeopathy, and that's the Hahnemannian definition. If we go down the road of anything else, we'll lose it very, very quickly. So that's what I would say. However, I would never, would want to say, you're not allowed to do this or you're not allowed to do this. So to legalize anything like that, or to bring in some kind of enforcement measures or something like that. We don't need that, I mean, we live in a world already which is far too regulated, So in that way, I would say, no, let's be liberal here. However, these things are always decided by themselves. They go by the wayside. We just need a historical perspective. So if we now look at the 19th century and we look what has actually survived, what has survived is Hahnemannian homeopathy. Who do we go to? What are the great sources of the homeopath we look at? They are Hahnemannian homeopaths. All these eclectics, all these people who did this and this and had wonderful ideas about this or that, it's all gone. Nobody even knows them anymore. But now we have this wonderful book, the Lippi book by André Sand, 2 volumes. Altogether, it will be 5 volumes. I mean, this again, I think, has the potential of giving us a new foundation in homeopathy, a new old foundation in homeopathy, to remind us what actually is homeopathy in its origin, and that it is exactly that still today. And this is the thing, usually, what you just said, 250 years, nothing in that sense has changed. Herring already said, while Hahnemann was still alive, don't hold on to your theory, Samuel. Whether he said Samuel, I don't know, or whether he said Dr. Hahnemann.
Buddy,
but they were friends. They knew each other. But he was a much younger man, But he said, don't hold on to your theory. Don't be in love with your theories, because they're the first ones to go. And I think he was right. I mean, Hahnemann got quite a few things wrong. He got things wrong on syphilis, for example, where he thought if you don't suppress the syphilitic chancre, the disease will never go into secondary, tertiary stages. That was a completely wrong observation. And with that also, again, his mechanism theory becomes a bit shaky, because it is based on the syphilitic model, really, and then he transferred it to the psychosis, and then he transferred it especially to psora, which, in my opinion, and this may be controversial for some people, but it doesn't exist. We have to let go of that. Psora does not exist. It doesn't make sense,
Why do you
However,
say that?
well, because the psora, I mean, if you just look at what Hahnemann says about psora, I mean, Hahnemann, we're looking at Hahnemann. I'm not saying that later interpretations of psora as an underfunctioning or something like that is not useful. I don't use it myself, but I wouldn't want to say that's not useful for others, However, with Hahnemann, it was very clear that he said psora is scabies, and scabies was originally leprosy. End of story. We are already in a field of fantasy, Leprosy never changed into scabies. They're two completely different entities. So therefore, this whole thing about scabies being the instigator or the original infection and then the suppression of scabies leads to all these 7/8 of all chronic diseases and so on and so on. I think we just have to admit it does not exist. There is no medical entity psora. And also Hahnemann, remember, just said we have to give it a name. So we call it psora. So he knew already that it was ill-defined, And in that way, I would say, let's get rid of that, because otherwise we get far too confused and we try to make sense of something which simply doesn't make sense, however way we turn it. And that also leads only to more confusion with students, And the syphilitic theory and so on, that still stands, and the psychosis and so on and so on. But we know even with the psychosis, are there really such great consequences, which then lead to all these severe chronic diseases and so on? There is some doubt about that, That's what I mean. However, and this is important, Eugenie, even if all of this goes, let's say the whole psora theory, nothing changes in the way we treat chronic diseases. That is important. But the only thing is that we don't speculate on the original cause. The original cause for Hahnemann of each genuine chronic disease was always infection. That's all. We have to let go of this. It's not that difficult. And we can be proud that Hahnemann saw so many diseases which potentially had an origin in infection, if that exists. We have now the medical medium, William, his name is Williams. I can't quite remember his first name, but he, for example, says Epstein-Barr virus. It's all about Epstein-Barr virus.
Yeah.
But this is really a modern version of the miasm theory of Hahnemann, which is very interesting. So in that way, Hahnemann, of course, is still alive also in these quarters. But I think we can let go of this, and we still treat the chronic diseases exactly like Hahnemann taught us to do. And this is the thing, look at the Organon, 72 paragraphs of theory, the rest up to 291, from paragraph 73 to 291, it's all practical application, So in that way, homeopathy is practical. Look at the first paragraph of the Organon, we are not supposed to speculate. We are not supposed to do homeopathy in order to become a professor of medicine and lecture on materia medica and so on and so on, but we are there to help the sick. That's all. In that way, nothing changes. So the way we treat diseases, the way we take our cases, the way we match materia medica with natural diseases, all the same, But theories which do not hold water, I mean, that's my contention, they can go, and there won't be a loss, I think always, usually, just very quickly, and I know this can be controversial, and again, I need to really stress that there are people who use the miasms in practice, and they do it really, really well. And they really get success with the way they use it. So in that way, I just want to make clear that I would never doubt that, okay, that people have these experiences. However, my sort of question to the students would always be, okay, now you've taken your case. Now you analyze your case, Now, does the addition of the miasm theory, does that lead to a higher precision in your prescription? Yeah. Is the classification system of the miasms so good and so clear and so consistent that you can use it as a very precise tool to get even a more precise prescription than without? That would be my only thing where I would say. And then have a look, and there's a German colleague of mine, Roland Medner is his name. He's also part of the Materia Medica group with André Sen, and he bothered to actually write a long book on this, and he bothered to look at all the miasm theory from the beginning to today, compared all the different theories and all the different homeopaths. And on top of that, did actually an analysis of 2,000 of his own cases according to the standard Meisen theories. And his conclusions are very sober. He says no consistency, classification systems are not stringent, or are not
Wow.
very consistent, and so on and so on. So in that way, usually just the last thing on that, I think, and homeopathy never stops. Okay, so that's also important. So anyone who talks about, oh, we need to go back to Hahnemann, that doesn't mean we stop with Hahnemann. That would be madness. But the two developments, which I think have always been ongoing and are still ongoing, and they will never stop, and they're very important, is prosology. We still haven't completely cracked that. We still have too many aggravations. We still have too many uncertainties in terms of, well, we seem to got the right remedy, but did we get the right potency? And then we have to experiment with the potencies and so on. So that, I think, it's still a field. Like, look at the Fibonacci potencies we recently got. I think that's a very interesting development. We need to look at that. And the other thing is, of course, still an increase of our materia medica. So this is an ongoing project. And we could argue, well, if you know the 120 remedies of Hahnemann roughly, well, plus herring remedies, if you know 200 of the standard remedies of Hahnemann and herring, well, you probably can run a really good practice, a successful practice. Yes, however, we have so many new remedies which came on board and which are wonderful, beyond herring, Hahnemann and Stapf and all of these people, that I think that's in the development which will never stop. But again, it will be there, the same thing with quality control. Well, the first thing we have to say is we have no real collective quality control. So we have to be honest with that. But it is all, I think these things resolve themselves. That which has real substance, which really leads to success, repeated success, consistent success, that will always survive. The rest will go by the wayside. And hey, let people do their own thing. I think it is important. And so we shouldn't be in that way restrictive, but we should also at the same time always remind people what homeopathy is in its origin,
And this past hour, I just want to say that when I ask the students, who are some of your favorite lecturers? So many of them say Ralf. And I love your philosophizing brain and the way that you have thought so many of these things through. And I really like the thread that you're going on, because you're answering a lot of questions that I've had. And I would love to chat many more hours with you, because I have many more questions. But for now, I have a couple I'd love to ask you as well. You made a really good point there. I love what you said about, at the end of the day, even though there were all these eclectics, it's still Hahnemannian homeopathy that's withstood the test of time. And that's actually quite reassuring to remind me when I see all the crazy stuff going around me, which, I say now crazy stuff, but in 10 years' time, I'll probably be doing them, because I do a lot of stuff now that 10 years ago I said crazy and I would never do it. But I think at the end of the day, for me, it's always the clients, because when they go to somebody who calls themselves a homeopath, because there's no like kind of standardization. I've heard a client say to me, she went to this homeopath and this homeopath just wanted to pray with her. And she felt wildly uncomfortable by that, because this wasn't her faith. And so, so now this person, their perception of homeopathy is that it's people that pray for you, so that's kind of like more,
Yes.
I think I just don't want to be, what's the word, swept under the same brush, or like painted with the same
Yes.
brush as somebody who does
Yes.
something like that, because I, have my way of working. So
Yes.
I've often thought maybe we just have different like categories, and maybe there is an organization called Hahnemannian Homeopathy. And if you want to be registered by them, then you need to pass this test and practice a certain way. And then you can call yourself a certified Hahnemannian homeopath. So then as a client or as a general public, if you want to find somebody who practices that way, you go to a Hahnemannian certified homeopath. Or if you are somebody that is, you pray with your clients, and there are lots of homeopaths that want to do that, then you are maybe you called a different thing. And then the type of person who really likes that and wants that type of homeopath goes to that type of homeopath. I just think from a general public point of view, because I often, and I'm sure you've had this too, had clients come to you who've seen many other homeopaths and all practice wildly differently. And then they say they've wasted so much money because of this person does this and this and that. And so I'm just kind of thinking from that point of view, I just would like to make it easier for the general public to know that when they book with someone, that this is what they're going to get. But I guess that's probably another talk. I'm going to throw that one at you. You can answer that or not, you can decide. But also, with pathology, Homochords are obviously like super trendy at the moment, and the theory is that you just throw all the potencies of the remedy into one bottle, and the vital force will take the potency that it needs.
Mm, mm. Okay. Well, the last one I cannot comment on, to be honest. And I feel conservatively uncomfortable about that, but that's just me. I feel like, oh my God, then we are giving up, in a sense. It feels like for me, we are giving up the whole potency scale and the beauty of, hey, the specific character of the 10M and the specific character of the 50M. And anybody who has done homeopathy for a while, of course, has a sense of the different energies of these potencies,
Yes. And
And so in that
also,
way,
you learn so much. Like if the person did badly on that potency you gave, it teaches you
yeah,
so much about that
yeah.
person and where they're at in their disease state. And, like I think that is so powerful. That's why I resist throwing them all together, because I think there's lessons to be learned. Even if it's the wrong potency, it still teaches you something
Yes.
about that person, which better informs you what to prescribe next time.
Yes, and also usually keep always in mind, this is the problem, of course, we have with homeopathy. If we, from what point onwards does this throwing together of the potencies given to patients, does this become in any shape or form convincing in their result? So when can we say, oh, we have done now so many cases with only these potencies and so many different pathologies we've treated and so many different do you know what I mean? It's, again, it has to be a collective thing in order to bring it to attention. Is that something we want to do? Because otherwise we are back to individual experiences, and individual experiences may be useful, but by and large they really don't tell us that much. It's unfortunate, and that's of course with homeopathy, because of the individualization, we never have a contrast. So we never know if we would have done it differently, whether we would have got the same results. We also have to be clear on that. But anyway, the other thing with the standardization, I think we are now at a time where there are efforts being made, and André Sen, for example, with his school, is certainly in the forefront of that, to standardize it, to bring back homeopathy into Hahnemannian homeopathy into focus, and so on and so on. And I think you can make a very, very strong argument for saying, well, homeopathy really should be a trademark, and it can only be a trademark according to Hahnemann. It can own, otherwise it would be unfair, Hahnemann never trademarked the whole thing, he never copyrighted it. He just gave it to all of us and hoped for the best. And of course, he was already right at the beginning very disappointed that he realized that people do with it what they like, So, but I think that's something we cannot stop, and we shouldn't stop. That's what people do. That's what we as humans do. We have a boundless curiosity, but also, unfortunately, a boundless laziness, So meaning we could only agree, let's say we want to call homeopathy just according to Hahnemann, but that would first of all mean, well, we all have to read him and study him in the first place, But there's so many who say, well, we don't have to do this anymore. The Organon is obsolete and we have better books now, and so on and so on. So that's where the problem starts already, So in that way, I think we are far away from a standardization, and I think it would be a really, really difficult thing. And I think at this stage, we just have to let it run and see how it goes, and look at those teachers who have wonderful results, who can teach well, who can, let's say, make a plausible case for what they do with homeopathy, And whenever we have doubts, and I think that's really important, whenever we have doubts about understanding something or that it doesn't make sense, I think we should trust that inner voice, Because with Hahnemann, the one thing I would say is he makes sense. And it's easy to follow. He is very transparent, and we should look for those teachers. And that's why, for example, like André Sen, he's a very transparent teacher. He really shows his cases, he shows his successes, and some of them are astonishing. And he also shows his failures, and he shows how cases can be derailed. Even the most accomplished homeopaths have the same problems like we have. Suddenly you are prescribing one remedy after the next, and you're chasing the and so on and so on. But the beauty is that in this, André is very transparent. And I think that's what is important, that students really go for teachers who are transparent, explain their stuff very well, but also, and this is another thing, work within limitations, so that there is not constantly this excuse, why there was no success with the treatment. Then at least we can say, well, I used the standard method of Hahnemannian homeopathy and I did not get the result, full stop, So, but otherwise it becomes it becomes an open, endlessly open thing of excuses why we weren't successful. And I think we have to admit Where we are successful, be clear, look, this is a very successful case, but equally, I used the same method, the same kind of treatment, but it didn't work, so that we then are aware of also the limitations of the thing we do. One other thing usually, which I found interesting with this praying, I mean, it's so easy, and I just had a case now, and I know there is a religious background, and it is also a case of intrusive thoughts. And we know that Christianity, whether Orthodox or whatever, can deal well with intrusive thoughts through prayer. Okay. But then when you have a patient who is already on that road, what I would then say is, do you pray? I would ask them, do you pray? And if they say yes, I pray and so on, then I would possibly say, well, with the intrusive thoughts, you do know that one of the very effective ways of dealing with intrusive thoughts is praying. Be in prayer as much as you can. But that would be an individualized case. Now, if you say this to an atheist and you say it right at the beginning of your consultation, I think, what's the point of that? They will think you're mad, of course. But do you know what I mean? So in that way, it is just a question of how we can bring in so many things. And I would also say we can bring in spiritual teachings as well. There's no problem with that. But the thing is, first and foremost, we are homeopaths. We are not spiritual teachers, But if we have, of course, a spiritual background and we know how effective certain spiritual methods can be, yes, bring this in by all means, but do it, of course, on an individualized basis, and always take the patient with you. That is the key, otherwise you alienate them. We know that. And so you adjust, obviously, according to what the patient can and wants to do. It's so simple. But if you front load that, and that's the problem, that is actually one of the problems with Kent, and not Kent himself, but the students of Kent, he front loaded his spiritual beliefs, the Swedenborgian beliefs. And I love Swedenborg, so I have no problem with that. But he front loaded that, meaning he now judged everybody according to a fairly rigid, and Swedenborg wasn't rigid, but Kent was a bit, quite to a dogmatic kind of worldview, a Christian, nearly fundamentalist kind of worldview. And then we're losing it already. Then we lose paragraph 6, the unprejudiced observer, And it's not so much Kent himself, because when you look at Kent's cases and his lesser writings, he was a Hahnemannian. He prescribed like Hahnemann. But in his lectures, which were written down by students, of course, he comes across as being somebody who was quite dogmatic and had already made up his mind about everything according to his Christian beliefs, And that, I think, could be a problem if we front load this stuff,
I have a random question for you.
Yes,
So
please.
in the German books that you've read, is there anywhere where it fundamentally says where the idea of succussion came from? Because I've heard a story about him going to a house and then being on the horse cart and then the remedy shaking in the back of the cart and he got to the other side and it was more effective, and that's where the idea of succussion came from. But I have not heard anyone say definitively that this is where he wrote, or this is where he got the idea of succussion from.
No. So what I would say with the carriage, I think we knew about succussion. We knew about succussion, and then somebody thought they noticed that when they use them, the bang, 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 that they become stronger and stronger over time. But that was not the beginning of it. That was already known about succussion. And then they realized, with Hahnemann, no, I would say, as far as my knowledge goes, there's nowhere where he explicitly states where he got this from. But I think it's safe to assume that he got it from the alchemists, and he got it from there's a doctor, I can't remember quite, and he was pre-Hahnemann, and Hahnemann mentions him, and he knew already about the Succussion dynamization of remedies and so on and so on, and he already also stipulated about microorganisms and so on, even before the microscope. Can't quite remember his name, Helmholtz or something. I can't quite remember. It maybe will come to me later. So in that way, Hahnemann definitely had precursors, so he knew about this from other written sources. And my sense is, he must have known Paracelsus. There is no way that he didn't know Paracelsus, but he never mentions him. It's a very strange thing. And they're so close in terms of temperament, in terms of outlook, that I think sometimes as if Hahnemann deliberately, because he knew he was so close to Paracelsus. But the succussion thing was, of course, known already by the alchemists. And Hahnemann being a chemist, he took it from them, But of course, the direct experience, I think the direct experience Hahnemann had with the Succussion, that shook him to the core, because I don't think he expected that. That also he now, and maybe he was the first one to label it as such, that now he could open like an inner source of a material substance, an inner spiritual source of the material substance. And this, of course, once you fully integrate that into your life and into your being, that changes everything. That changes your whole outlook on life. And Hahnemann must have felt pretty lonely at that point, because most people thought, of course, this is completely madness, And even now, we still live in this materialistic age. Most people think, yeah, and poo-poo it and so on and so on. However, but I think it shake him sufficiently to be so cautious with his posology, because when you look the steps he took, the small steps he took, and he couldn't believe it. He thought, oh, wow, it's still active. Oh, it's still active. And even if I add 1 second, oh, it's still active. That was his wonder. And then at 30, he suddenly said, okay, enough. It's like enough is enough, and so on. But anyway.
Fascinating, Ralf. This has been the most wonderful experience speaking with you. I really, really hope you can come back on the podcast and talk to us more. I know we're going to get a few questions after this one, and hopefully you can come back and chat with us some more, because I was still going to ask you about the podiatry and about, a few other things that you do as well. And your garden, you mentioned about using homeopathy in your garden. I think I heard some roosters crowing earlier. Have you got roosters out there?
Well, not here. There will be seagulls. I'm at the moment in Brighton on the south coast.
Oh, it would be seagulls I was hearing then. But I definitely want to hear about your agri-homeopathy in your garden at some stage as well. But I'm just aware of the time. So please, can we schedule in another chat? Because this has been absolutely wonderful. Well, Ralf, thank you so much. I still have a couple of your lectures to go through at CHE because, like I said, I'm pretending I'm a student and watching all the lectures all over again. I saw that you have some there on Kent, and I think I saw one on Burica, I think.
Yes,
On the lectures.
Berninghaus.
Oh, Bonninghausen. And I saw another lecture that I need to watch still, and it was one more lecture that I actually thought sounded really intriguing that it was Hahnemannian homeopathy. There was another lecture on Hahnemannian homeopathy that you had as well. But that was, do you lecture much for the second year of the fast track as well?
Yes, okay, I do the fast track. Yes, absolutely.
Okay, no, because I'm still, so we are at the moment, we've just finished our 3rd month of the fast track. I did scroll ahead to see what's coming up, and I saw that there's some more lectures coming, but I am going to be hanging out with you online many more hours and listening to your beautiful wisdom. So thank you so much for coming on the podcast today and sharing your knowledge with us and giving us some great food for thought and challenging our minds and just giving us some new ways of thinking, which I think is really important and very healthy.
Thank you, Eugenie. It has been a real, real pleasure. Thank you very much for having me.
Dankeschön.